Jonathan Stoiano. I'm a consultant plastic surgeon, and I'm going to talk about breast implant illness. This is something that we've had a few inquiries through recently, and I've had quite a few people ask me questions about it. And basically what you'll see if you research on the internet, there are people out there who have had breast implants, silicone breast implants, and have become ill following having these implants and feel like the implants have made them feel ill. And not only that, they've also sometimes had the implants removed and they feel better. And so there's a concern that silicone breast implants may cause illnesses. The sort of illnesses that people complain of are range from fatigue, general malaise. There's quite a lot of connective tissue disorders, things like SLE, rheumatoid arthritis, and things like this that people have developed having had implants. And it goes to the extent that some time ago in the United States, a group of women came forward to say that implants were making them feel ill, and so there was a moratorium on silicone breast implants. They were actually removed from the market because there was concern that they were making patients feel ill. Now, there has been several very large scale studies that have looked at this, and there is no current scientific evidence that suggests that breast implants do make you feel ill. And so the advice that we give to patients is that there isn't any evidence to say that these breast implants are making people feel ill, and it's just that if you're putting a lot of breast implants in, then occasionally you're going to get a patient who will develop SLE or rheumatoid arthritis or some connective tissue disease after having the implant in, and they'll associate it with having the implants in, but it wasn't actually the implants that was causing it. Now, I have to say, there's no evidence for it. That doesn't mean that there isn't a link, because occasionally you do see people who say that the implants make them feel ill, and removing the implants, they feel better. I have to say, as a plastic surgeon who specializes in breast implants, I don't see this very often, and it is extremely occasional that you do see it. But nevertheless, we have to accept that it is out there, and certainly if you look on the internet, people do talk about it. So it is a thing, but from a medical point of view, there is no evidence for it. So I'm not saying that there isn't a link, I'm just saying that we haven't found a link. So if there is a link, we haven't found one. We might find one tomorrow, but we haven't actually found one at the moment. So really the advice is, if you're thinking of having breast implants, then weigh up the pros and cons. There are pros and cons with everything. And I've got to say, there are more tangible and well-proven potential risks with having implants. There are things like wound healing problems, infection that might require the implant to be removed, capsular contracture, which is the implant getting hard over time and might need it to be replaced. So these are very real things that can happen. So there are things that can happen if you have breast implants, and you have to weigh up the complications against the benefits. And the benefits is really only that you can answer that, what the benefits they are going to bring to you. And breast implants bring huge benefits to a lot of patients. They increase self-esteem, make you feel better about yourself, give you more confidence, self-confidence. So there are lots of benefits to having implants, but nevertheless, we can't shy away from the fact that there are potential bad things that can happen. So it's just something to put into the process to make a decision yourself whether implants are right for you. No one can make that decision for you, but be aware of the facts, and the facts say that there is no scientific evidence, but there is what we call anecdotal evidence. There are people out there who have said they've been harmed by it, but there are many millions more people out there who have had absolutely no problems. And it's up to you to weigh what that risk is for you with having implants, so you can make a judgment on whether they are right for you. I hope that's been helpful. There's more details on my website. You can download a guide with some frequently asked questions about implants, and I hope you find that there's some useful resources there. And well, good luck with your search, and I hope that you can make the decision that's right for you.